Choosing to embrace the change from original Medicare isn't just about signing up an application. It's about truly understanding how to navigate and utilize your Medicare Advantage plan coverage effectively. That's why I tried to cover this topic. So, with such a significant portion of Medicare eligible population now participating, it's vital for each beneficiary to be well informed on how to maximize the benefits and services available through these plans. When you have Medicare Advantage for the first time, here are important steps to take, and I'm going to give you examples. First, of course, understand your plan. Familiarize yourself with the details of your Medicare Advantage plan. This includes knowing your plan's coverage, a network of providers, and any additional benefits it offers. Well, for example, take time to review your Medicare Advantage plan's coverage details. Well, suppose your plan includes dental, vision, hearing coverage. Well, in that case, understanding the specific services covered, like annual dental checkups and eyeglasses prescriptions, can help you maximize these benefits. Review your ID card. Well, carefully examine your Medicare coverage ID card. Ensure that the information is correct, including your name and the member ID. Well, for example, when you receive your Medicare Advantage ID card, double check the accuracy of the information. Well, this attention to detail can prevent administrative issues later. Like, for example, you want to go visit the doctor and the information is not correct, okay? So, provider network. Know which doctors, hospitals, specialists are in-network for your plan. While using in-network providers typically results in lower out-of-pocket costs. For example, let's say you need to see a specialist for a heart condition. Well, before scheduling an appointment, use the plan's online tool to search for in-network cardiologists in your area. This can help you avoid unexpected out-of-pocket costs. Well, if you have a cell phone, you could just download the app of the carrier you are enrolled in, and you will be able to see those specialists, or of course, you will need a referral if you're an HMO. Make appointments. Schedule any necessary appointments with healthcare providers, especially if you have specific medical needs. Check if your plan requires referrals to see specialists. Well, for example, if you have a chronic condition like diabetes, schedule a telehealth or in-person appointment with your primary care physician to discuss your management plan. Your doctor may also provide referrals to specialists if necessary, ensuring you follow up the correct process per your plan. Prescription coverage. If your plan includes prescription drug coverage, find out how to use it. Make a list of regular medications and check if they're covered. Well, for example, if you take medications regularly, it is a must that you create a list of all your prescriptions and dosages. Then consult your plan's formulary list of covered drugs to confirm that your medications are covered. Well, if not, discuss alternatives with your doctor, of course. He knows best, or she knows best. Payment responsibility. Well, understand your financial responsibilities such as co-payments, co-insurance, and deductibles, which is standard to health insurance. Well, keep track of your healthcare expenses. Well, for example, suppose you're prescribed a new medication with copayment of, say, $30. Keep a record of this expense along with any other healthcare costs like copayments for doctors, visits, and why? Because this helps you budget for healthcare expenses throughout the year. Preventive services. Learn about the preventive services covered by your plan. Many Medicare Advantage plans offer free or low-cost preventive care. Well, example, take advantage of the preventive services offered by your plan. Schedule a free annual wellness visit with your primary care physician. Well, during this visit, you can discuss your health goals and any recommended screenings. Customer service. Save the contact information for your plan's customer service. They can answer questions and provide information on benefits and assist you with any issues. Of course, stay informed. Stay informed about any changes to your plan. Medicare Advantage plan can change their coverage and benefits annually. So, review the annual notice of change, which we call ANOC, when you receive it. It's just like when you're enrolled in that plan, you will receive the ANOC before it takes effect. So when you receive your annual notice of change in the mail, read it carefully. If you notice that a medication you take regularly will no longer be covered, you can discuss alternative options with your doctor. So health and wellness program. Explore any health and wellness program or additional benefits your plan offers, well, such as fitness membership or telehealth services. Well, for example, the example of this is explore any wellness programs offered by your plan. Well, suppose they provided discounts on gym membership. Well, in that case, you can enroll and stay physically active, which can contribute to your overall well-being. Of course, it's not bad to advocate for yourself. Be an active advocate for your health. Don't hesitate to ask questions, seek second opinions, and stay engaged with your healthcare decisions. Well, for example, if you're unsure about proposed treatment plan, don't hesitate to ask questions. Well, for instance, if your doctor recommends surgery, seek a second opinion to ensure it's the best course of action for your health. Well, transitioning to Medicare Advantage for the first time can be a positive step towards a comprehensive healthcare coverage. Well, by understanding your plan, knowing your rights and responsibilities, and staying informed, you can make the most of your Medicare Advantage experience. So now, we'll go to our Healthy Senior segment. Well, I found this video that will remind you to stay healthy. Well, please watch this.
People in the U.S. are living longer than ever before. Many seniors live active and healthy lives. But there's no getting around one thing: as we age, our bodies and minds change. There are things you can do to stay healthy and active as you age. It is important to understand what to expect. Some changes may just be part of normal aging, while others may be a warning sign of a medical problem. It is important to know the difference and to let your healthcare provider know if you have any concerns. Having a healthy lifestyle can help you to deal with normal aging changes and make the most of your life.
Are you passionate about making a difference in lives of seniors? Join our team and be part of something meaningful. We specialize in providing health insurance to seniors and individuals on disabilities. Our mission is to improve lives and ensure access to quality healthcare needs. When you join our team, you open the door to endless opportunities for personal and professional growth, with a possibility of making six-figure income annually. We believe in investing in our employees and helping them reach their full potential. At our organization, we foster a supportive work environment and a collaborative culture. We believe in teamwork and value the contributions of every individual and give all the support necessary for you to achieve your goal. Ready to start your journey with us? Contact Maria Garcia at 310-926-4229 to learn more about the exciting opportunities waiting for you. Your age is not an issue, your compassion is what counts. Call or text Maria Garcia at 310-926-4229 for current job openings and take the first step towards joining our team.
Welcome to Secure Your Loved Ones. We will show you how a final expense policy can provide financial security for your family. With a final expense policy, you can have peace of mind knowing that no medical exam is required, regardless of your age, illness, medical history, or incarceration. In addition, our final expense policy includes a free accident benefit rider that doubles the policy amount in case of accidental death. We understand the importance of honoring your loved ones without breaking the bank. That's why our final expense policy includes funeral negotiators who work to get you the lowest costs possible. Not only that, but you'll also enjoy a 30 to 80% discount on funeral merchandise, including a casket with a locked-in price of $2,000. Secure your family's future by choosing a final expense policy. Don't leave them burdened with huge unpredictable expenses during a difficult time. Call Maria Garcia at 310-926-4229 to learn more about how a final expense policy can provide financial security for your loved ones.
So now we go to our Medicare Q&A. First question is, are there any limitations on coverage such as pre-existing conditions or certain treatments for Medicare Advantage? Medicare Advantage plans are not allowed to deny coverage based on pre-existing conditions. This is one of the key protections provided by Medicare. When you enroll in a Medicare Advantage plan, you have guaranteed issue rights, which means you cannot be denied coverage or charge higher premium because your health status includes your pre-existing conditions. Well, however, there can be some limitations or restrictions on coverage for certain treatments or services within Medicare Advantage plans. These limitations are not related to pre-existing condition, but it may include network restrictions, wherein Medicare Advantage plans typically have a network of doctors, hospitals, and other healthcare providers. Well, if you receive care from out-of-network providers, your plan may not cover the costs except in emergencies or under specific circumstances. Well, for example, let's say you have a pre-existing heart condition and you need specialized care from a cardiologist. If the cardiologist you've been seeing for years is not in your plan's network, you may have to switch an in-network cardiologist to receive full coverage. Well, prior authorization. Some treatments or procedures may require prior authorization for your Medicare Advantage plan before they are covered. Your doctor may need to submit a request and provide medical justification for the treatment. Well, an example of this is, suppose your doctor recommends a specific surgery for your condition. Well, before the surgery, your doctor must obtain prior authorization from your Medicare Advantage plan. The plan will review the request to ensure it's medically necessary and meets their criteria for coverage. And then there's what we call step therapy. In some cases, your plan may require you to try less expensive or alternative treatments before approving coverage for more costly treatment. This is known as step therapy. Well, an example of this, if you have arthritis and your doctor prescribes a brand name medication as the initial treatment, your plan may require you to try a generic medication first. If the generic is ineffective, your plan may then approve coverage for the brand name medication. Quantity limits. Medicare Advantage plan may place quantity limits on certain medications, meaning they will only cover a limited supply of a medication within a specific time frame. Well, for example, you have a pre-existing respiratory condition and require a certain inhaler medication. Your plan may limit coverage to 1 inhaler per month. Well, if your doctor prescribes a higher dosage or more frequent use, you may need to pay out of pocket for the additional inhalers. Coverage changes. Medicare Advantage plan can change their coverage from year to year. It's important to review the annual notice of change each year to understand any modifications to your plan's benefits, coverage, or costs. Well, for example, in 1 year, your Medicare Advantage plan covers a specific type of physical therapy. However, the following year, they decided to exclude it from coverage. Well, you will need to adjust your treatment plan according or consider switching plans during the annual enrollment period. And lastly, specialized services. Well, some plans may limit coverage for specialized services or treatments that are not considered medically necessary. Well, an example of this, you may have a rare pre-existing condition that requires specialized treatments available only at specific medical centers. Your plan may limit coverage or treatments considered medically necessary, and specialized experimental treatments may not be covered. It's crucial for Medicare Advantage plan members to carefully review the plan's documents, including the Evidence of Coverage or EOC and formulary, to understand the specific coverage and any limitation that may apply. Well, additionally, if you have questions about coverage or if your doctor recommends a particular treatment, it's advisable to contact your plan's customer service or appeals department for clarification and guidance. So now we go to the next question. How much will it cost me to get preventive care from my Medicare Advantage plan? The cost of preventive care under a Medicare Advantage plan can vary depending on the specific plan you have. However, there are many general considerations. So actually, no-cost preventive services. Medicare requires that all Medicare Advantage plan covers certain preventive services at no cost to the beneficiary. This means there should be no co-payments, co-insurance, or deductibles for these services. Well, examples of no-cost preventive services includes annual wellness visits, various vaccinations such as flu shots, now they included shingle shots, and then screening for certain cancers like mammograms, colonoscopies, cardiovascular screening, and bone density tests. Oh, of course, don't forget diabetes screenings as well. Next is Part B premium. While many preventive services are covered with no out-of-pocket costs, you may still be responsible paying for Medicare Part B premium. This premium is standard cost associated with original Medicare's Parts A and Parts B, and is typically deducted from your Social Security benefits or paid directly to Medicare. Additional benefits. Some Medicare Advantage plans may offer extra, actually all of them offers extra preventive services that go beyond what original Medicare covers. These extra services could include vision screening, dental cleanings, and fitness programs. The cost sharing for these additional benefits can vary from plan to plan. So, in-network versus out-of-network. If you receive preventive care from an in-network provider, it's generally covered according to the plan's terms, which may include additional costs. However, if you choose an out-of-pocket network provider for preventive care, you might incur higher costs or it may not be covered at all. It's essential to review the details of your specific Medicare Advantage plan to understand how preventive care is covered and any potential costs, of course. The plan's evidence of coverage, or EOC, and the summary of benefits should provide clear information about what preventive services are included and what, if any, out-of-pocket costs you may incur. Well, additionally, you can contact your plan's customer service or for specific cost-related inquiries. Well, another hour had passed. Before I wrap up this special episode of Maria Cares, I want to take this moment to express my heartfelt gratitude. First and foremost, a big thank you for my incredible production team whose hard work and dedication made this show possible. As we bring this heartfelt episode to a close, we would like to extend our deepest gratitude to Byron Goins, Director of the Martin Luther King Jr. Senior Center, for gracing us with his presence. Well, your unwavering commitment to the values of compassion, empathy, and support for seniors serve as an inspiration to us all. Your presence here today and the continued support you provide to our beloved seniors are testaments to the positive impact that a single person's passion and dedication can have on an entire community. Well, as a newcomer to Medicare Advantage, remember that knowledge is the key to navigating the your healthcare journey. Your transition to this comprehensive program opens a world of possibilities for your health and well-being. Remember, Medicare Advantage is a program designed to put your health first and provide you with the care you deserve. Well, thank you to my loyal viewers for joining us on this journey of senior information and care. Your trust and support mean the world to me. I would like to extend my love, hugs, and kisses to all my clients. And to those who are looking for a reliable agent, I'm looking forward to becoming a part of your Medicare journey, especially this coming enrollment, October 15 to December 7. Well, join us next time as we explore more compelling subjects that matter to our community. Well, until then, take care, stay informed, and remember that together we can build a brighter future for our seniors. This is Maria Garcia of Maria Cares saying, take care of your health. That's the only one you got. Let's join hands for better health.